So here we are with our fibula, and in all honesty, the fibula seems to be one of the more harder bones to demonstrate laterality and kind of the markings because they are very similar. So in all honesty, I'm going to describe these in relative terms because that's what they are. They're relative because I can't make it say, oh, this is completely flat, because it's really not. And so let's take a look at the fibula here. This is found in the lower leg. And so the first kind of thing we want to do, of course, as always, is to demonstrate laterality. So how do we determine that? We're going to use the markings to help us to do that. So let's begin to talk about these different ends. If I were to kind of do one of these actions, kind of like slap the top of the head or the bone, I find that if I slap it, yes, sometimes there's a little spike, but one of them is going to be a little bit more flat. Okay, keep in mind those are relative terms. More flat. Yes, you can have a big spike, but something, if you were to balance it, this is a little bit flatter than this end. Can you see how it's kind of tapered? And even if you have a big spike, sometimes the head will still demonstrate this nice and flat. So how do we determine? As I said, if you made a choice, which one did you kind of push down more and keep it flatter? That is the head. The head of the fibula is always proximal. So if this is the proximal end and this is the distal end, what we find on the distal end will also assist us in understanding what's medial and lateral. And so if I take a look at the distal end, this is the lateral malleolus. What you're going to find is this will have two different sides to it. One side will look like normal bone, while the other side is going to look very, very smooth and articulated because it is. It's articulated to the tibia. And hopefully you remember that the fibula is always on the lateral side of our body, so any kind of bone that will attach to it is going to be medial. I always think of fibula, frail, fragile, far away from the side of the body, so it's always on the side of the body. This is always lateral, so any bone, again, the tibia, is going to be on the medial side. So you're going to look at this. This is going to be the medial side, nice smooth surface because it's going to be articulated, and on this other side it's not. So that is the lateral malleolus. So we got head is proximal, and the distal end, and then this is the lateral malleolus. We find this surface, that's going to be the medial side, and here's the trick now. This is the problem because what you have to do is you have to pinch this to make sure that you have the medial and lateral side. Once I pinch this, I know that if I turn 90 degrees with my fingers like this, that this will be one of these sides. This is either going to be anterior, or this is going to be posterior, or this is going to be posterior, or anterior, this is going to be posterior. And the way that you do this, you keep your fingers pinched, and then you run your fingers along the top. And when you do, you'll find, by running it 90 degrees, as you can see from here, 90 degrees, one side is going to be sharper. This is my side that's going to be sharper, and you can kind of see this kind of bend if you want to just take a look at those features. This is what we call the interosseous crest. And part of the reason why we even have that is because the fibula, of course, is non-weight bearing, and so most of its job is either to support the ankle or muscle attachments, and that's what it's going to do. And you find all these sharp edges all the way around, and that's why I'm telling you, you have to hold it this way, because if I turn it, I see a sharp edge here, I see a sharp edge here. So which sharp edge is the interosseous crest? That's if I held it here, making sure that I feel either anterior or posterior, and this is the anterior surface because I can feel the interosseous crest. So this, of course, is now our left fibula, because if I put it on my body, this is going to be proximal, this is going to be distal, this faces medial, so this is the mid side, and then this always faces anterior towards the front, so it's going to be on my left side of my body. So that's the fibula. Our markings are the head, the lateral malleolus, and the interosseous crest.